What a pain is. Have you ever had a crook in your neck after studying for too long? Struggled up the stairs after one too many sets of squats? Had to limp around because you rolled your ankle at your soccer game? These symptoms of pain and inflammation can be relieved by a class of drugs called topical NSAIDs. NSAIDs stands for non-steroidal anti-inflammatory drugs. Ones you might have heard of are ibuprofen and paracetamol. NSAIDs can be put into topical creams or gels that can be applied directly to the area of pain. The drug then penetrates the skin, providing topical pain relief.
NSAIDs like Voltaren are commonly used and can be conveniently bought over the counter. NSAIDs work by blocking enzymes in our body called cyclooxygenase that makes prostaglandins. Prostaglandins are the chemicals responsible for causing inflammation and pain, and therefore inhibiting cyclooxygenase enzymes provides pain relief for our muscles and joints. There are two forms of this enzyme, cyclooxygenase 1 and cyclooxygenase 2. Cyclooxygenase 1 plays a key role in protecting the lining of our gastrointestinal tract, while cyclooxygenase 2 is more involved at the sites of inflammation. Topical application localizes the drug effects to the site of injury, while limiting absorption to the rest of our body. This is beneficial as this spares the protective role of cyclooxygenase 1 in our stomachs, and targets more of cyclooxygenase 2 that is present at the sites of musculoskeletal pain.
The following section on side effects and drug interactions of NSAIDs might be a little bit overwhelming, and hence, speaking to your GP is a good idea if ever in doubt. The most frequently reported side effect was irritation of the area where topical NSAIDs applied. This can appear as redness, itchiness, or allergic response on your skin. Compared to oral NSAIDs, topical NSAIDs are less likely to have more serious side effects, but it still could happen. Some common side effects are shown here. Co-administration of NSAIDs and some drugs might contribute to serious drug-drug interactions or being the risk factors of some diseases. Some drug examples include aspirin, warfarin, alcohol intake, oral corticosteroids, lithium, and antihypertensives such as ARBs, ACE inhibitors, or thiazide diuretics. Here's an advice. If you have risks of following phenomenon or diseases, then it's better not to use NSAIDs or follow your GP's instructions.
First and foremost, follow the instructions provided by the manufacturer or speak to your GP. But here are some important points about usage. As we've mentioned already, these topical medications are pharmacological agents and cannot be underestimated. Although topical NSAIDs are generally safer than oral ones, they are still very capable of causing harmful side effects. Therefore, it's very important to follow the dosing instructions carefully. These can be more complicated than you may think. For example, Voltaren has different dosages and advice for upper and lower extremities, which can be measured using a dosing card. Generally, it's best to use the lowest dose possible, especially if you have a risk factor for NSAID toxicity such as cardiovascular disease. Again, speak to your GP to make sure. What about long-term usage? Despite a lack of long-term trials, topical NSAIDs are commonly used in chronic pain, such as the pain caused by osteoarthritis. Unfortunately, studies have suggested that they are less effective in treating chronic pain compared to acute pain. But don't lose hope. If one medication doesn't seem to be working, your GP may recommend using a different type which may work for you.